Hey, beautiful friends. I often get asked about needle angle and depth. So I wanted to pop online and share a quick video of my recommendations for needle angle in depth for your upper face. We'll focus specifically on the frontalis muscle and then also the glabella complex, which is your procerus and your corrugator. So I just did a quick markup, just a couple of points on my upper face. So my frontalis, I just did one markup point there, and I marked up my procerus and my corrugators. So with your frontalis muscle, if you have all of your markups done, it's a very thin muscle with thin skin. So it's a shallow injection. You're only going to go quarter needle depth in your frontalis muscle. And please note that when I talk about depths, I am talking about depths with an 8mm needle length. Now that's very important because you can get insulin syringes with different needle lengths. 12mm is another common needle length for injection syringes. So just make sure you understand what your needle length is when you're injecting yourself, okay? As I talk through this, I always use 8mm needles for my neurotoxin injections, and the ones that I prefer are the Easy Touch 0.3 cc syringes. So this is going to be a 30-unit insulin syringe, 8mm needle size. I'll try to zoom in a little bit so you can kind of see there. This is the 30-unit syringe. And if I were to uncap that, I don't know if you could see the needle on there it's not long at all. It's small. This is the 8mm. Okay. So for your frontalis muscle, if you assume that straight in is a 90-degree angle, right? This is a perpendicular angle. It's 90 degrees. What you're going to want to do is drop that needle anywhere between 30 and 45 degrees in the angle. So roughly somewhere between there and there is roughly between a 30 and 45 degree angle. So you will drop that needle when you're going into your injection point here, 30 to 45 degrees. You're going to go quarter needle depth, so 2mm depth in length into that injection point and inject, and then you're done. All right, so then moving on to the glabella complex. For your procerus muscle, for this muscle, you will pinch and hold, and you're going to go in straight in at a 90-degree angle. So a 90-degree angle, straight in. And this one is going to be full needle depth. So you're going to go all the way in, full needle depth. Typically that's going to be 8mm using an 8mm needle. Don't go in full needle depth with a 12mm needle. So full needle depth, 8mm. Okay. So 90-degree angle, pinch and hold technique, 90-degree angle, straight in, full needle depth. When you inject and you release, then hold that pinch for a 3 to 5 second count. Okay. Moving on to the corrugator muscles. For this first point, this medial point on each side of your corrugator, the technique that I recommend is to hold up on that brow bone to just kind of help isolate that muscle and the neurotoxin injection. So you're going to go in 90 degrees in this first point, and you are going to go only half the needle depth. So 90 degrees, which is straight in, half the needle depth, okay? As you move laterally, the second point, you're going to go 90 degrees in, continue to press and hold that brow, 90 degrees in, 1/4 needle depth, okay? So again, 90 degrees, quarter needle depth on that most lateral point. That the corrugator muscle does thin as it gets to the tail. You want to make sure that you're staying shallow in that area so that you're not injecting too deep, affecting muscles beneath that, which could cause ptosis, okay? So the best way that I remember for your injecting your glabella complex is it's always like full needle depth in the center, and then as you move outward, you back the needle out, you get more shallow, right? So full needle depth, half the needle depth, quarter needle depth, full needle depth, half the needle depth, quarter needle depth. All of these are going to be 90 degrees in, okay? Pinch and hold, press on the brow. Always after you inject, do a 3 to 5 second count before you release. That helps the neurotoxin stay a little bit more isolated to that area while it's being injected and diffusing into that muscle, okay? So there you go. Just going through it one more time really quickly. Frontalis muscle is going to be 30 to 45 degree angle, and you're going to go shallow, which is quarter needle depth. procerus muscle, full needle depth, 90 degrees in. Corrugators, 90 degrees, half the needle depth, 90 degrees, quarter needle depth. All right. I hope you found this helpful. If you have any questions, then let me know. I will post some more videos to talk about some of the other injection angles and depths for crow's feet, for lower face neurotoxin, for Nefertiti neck. So keep your eyes peeled for those videos, but feel free to let me know if you have any questions. And I am a DIY injection coach. So if you need help, if you have been wanting to do DIY, if you're kind of nervous or fearful about doing it on your own, then I am a coach and I can help you with your injection. I do a video call where I will walk you through all of your no-go zones, your facial anatomy. We'll make sure you're injecting in the right places. We'll make sure that you're injecting in at the right needle angle and needle depth. So, all right, I appreciate you guys. Let me know if you're interested, and I love you. And you guys have an awesome, blessed day. And also remember that you are fearfully and wonderfully made. Mwah.